Good morning, good afternoon, good evening to everybody. We're just welcoming everybody to the World Federation of Occupational Therapists webinar on the global strategy for occupational therapy workforce. There's more participants in the room. So we will begin. As I said, good morning, good afternoon, and good evening to everybody attending this webinar. My name is Richard Ledger, and I'm the Executive Director for the World Federation of Occupational Therapists. I'm delighted to be chairing WFOT's first ever webinar. We have over 1,000 people registered to attend, and I want to thank you for your interest and support today as we embark on a transformative journey for the occupational therapy workforce. As many of us here know, occupational therapy is a profession that reaches across borders, touching lives in ways and promote dignity, independence, and quality of life. Whether working with a child, developing new skills, supporting an adult recovering from an injury, or guiding an older adult through age-related changes, occupational therapists are at the heart of creating possibilities for people to engage in meaningful lives. But today the world is changing rapidly, and so too are the demands placed on our profession. We are facing unprecedented global challenges, from the rise of chronic diseases to the mental health crisis, from aging populations to the ongoing impact of natural disasters and conflicts. These shifts mean we need a workforce that is both agile and forward-thinking. The strategy we're launching today is not just about increasing numbers or improving access, though they certainly are vital components. It's about fostering collaboration, leveraging technology, and ensuring that occupational therapy can meet the demand and the evolving needs of diverse populations worldwide. Our vision is to create a global workforce that is prepared, innovative, and resilient, capable of responding to these challenges and thriving in complex, ever-changing environments. We aim to achieve this by focusing on several key pillars: education and training, workforce planning and development, advocacy and leadership, and research and innovation. Each of these areas is interconnected, and together they form the foundation upon which we can build a stronger, more effective occupational therapy community. This strategy is a result of extensive collaboration across nations, organizations, and experts in the field. It is grounded in evidence-based practice and represents our shared commitment to making a lasting impact. But to truly succeed, we need every one of you, therapists, educators, policymakers, and advocates, to actively engage with this vision. Together, we can ensure that our profession remains at the forefront of healthcare and that every individual, no matter where they live, has access to the transformative power of occupational therapy. I'm delighted to introduce our panel of speakers for today's launch. Each will provide unique insights into the development and interpretation of this global strategy. Dr. Diego Jesus, Workforce Strategy Project Lead, Dr. Claudia Bonset, WFOT Professional Advisor, Karen Orman from the World College of Occupational Therapists, Director of Practice and Innovation, Dr. Pache Douglas Sampson, WFOT Delegate from the Bermuda Occupational Therapy Association, and Samantha Stone, WFOT President. We welcome any questions using the Q&A feature in this webinar. We realize we may not have time to respond to them all. However, we will post subsequent responses in the Global Workforce Hub. So without further delay, I would like to hand over to our first speaker for today's webinar, Dr. Diego Jesus. Diego is our Workforce Strategy Project Lead. So over to you, Diego.
Oh, thank you very much for the wonderful introduction, Richard. My name is Diego Jesus. I'm an assistant professor of occupational therapy of the great Ohio State University. And as Richard well told, I've been the project lead for the development of this workforce strategy for the WFOT. So I'm here today to present a little bit of the context, needs and context for developing this global strategy, about the development process, about the aims and structure of the strategy, and providing a few final takeaways. So first thing first, what is the need and context for this global strategy? So on the population needs side, there is now a lot of data showing a massive increase in population needs for rehabilitation and occupational therapy from this landmark study in the Lancet to also other studies showing that those increases have been occurring across countries of varied income levels, including emergent economies and resource-poor world regions. And these have been some of the works that I developed before. But we were kind of questioning ourselves. So we would expect that for higher levels of rehabilitation needs, we will have a higher level of rehabilitation workforce supply, meaning the combination of physical therapists and occupational therapists together. And we tried to develop a study across 35 high-income countries combined to show whether that relationships was established or not. And this work was done by me and the current president of the World Physician, among others. And interestingly enough, we were wrong. There was no association whatsoever between the need for physical rehabilitation and the supply of occupational and physical therapists combined, but there were significant associations with a lot of socio-demographic and other variables. So, and you can see this a little bit better in this graphic that shows that although there was some variation in the physical rehabilitation needs in blue, they were kind of stable across countries, but there was a high variation essentially in the supply of occupational therapists and physical therapists combined. And more than that, there was a high variation in the distribution between physiotherapists or physical therapists and occupational therapists, ranging from a nearly 50-50% distribution in Israel to a 98.2% distribution, meaning 98 physical therapists for every 2 occupational therapists in Italy. So there is a wide range of variation in that skill mix. And this data is a little bit aligned with the data being showed by Human Resources Project of the WFOT, which also shows great variation in the supply of occupational therapists across countries, among other issues that need to be addressed in the occupational therapy workforce worldwide. So a little bit of context. So in the context of the global workforce developments that have been occurring in the World Health Organization, for example, in the rehabilitation field, but also in the human resources for health field with a global strategy, with a new portal of health workforce data, we realized that we needed to develop the first ever global strategy for the occupational therapy workforce. And in that regard, we would be the second profession to do that, just after the nursing profession have been doing that. So what has been the development process for this strategy? So the development process consisted of 10 different steps that were developed over the past few years. And the first of which was the development of a few scoping reviews to try to understand the status of the workforce research and data worldwide. And we published those 3 results from those scoping reviews, which were able to inform the next step. The next step was to develop a situation analysis using the SWOT tool, so a SWOT analysis, and we convened an advisory group to inform the situational assessment of the occupational therapy workforce. And same way, we published the results out of that, and the results of this process enable us to develop a first draft of the global strategy. That draft was sent through an initial mixed method survey to the WFOT delegates, and then the hotspots of that survey were subject to in-person focus groups discussions in Paris in the WFOT Congress in 2000 and a few years ago. And we were discussing those results and what were the topics that were probably not well addressed. And we also published those results as well very recently. Importantly, we published that in the Human Resources for Health journal, which is the main journal of the Human Resources for Health field. So we want the occupational therapy agenda to become part of the human resources development. And then we were redrafting, according to the feedback received, the draft, and we developed a follow-up mixed method survey against with the delegates to assess whether the strategies or the second version of the strategies were good enough at this point. And we are also publishing these results currently in a preprint version and currently under review. So what is the strategy aims and structure? So the strategy, what the strategy is and is not is probably the first question. So the strategy is a framework that articulates key strategic directions and more specific guidance on how to strengthen the occupational therapy workforce. It's important. It's aimed to inform and guide, but not to replace the development of context-sensitive workforce situation assessments, priorities, and plans within and across jurisdiction. So we can sum that up saying that the strategy is not an action plan. It aims to provide strategic guidance for everyone in across jurisdictions to develop their own situation assessment in their action plan, but it's not going to determine who is going to do what, where, how, or who is going to pay for it. That needs to be done at the local level. So the structure of the global strategy is as it follows. So we have 7 broad strategic directions, and for each of them, we provide what is the overall aim of that direction. What is the problem and opportunity? Because we were seeing in those focus groups that people wanted to know, why do we need this? And we also provide long-term and short-term goals for each of those strategies. And then we provide within those strategies specific guidance for action. In the total of the strategy, there are 22 of them, and it usually varies between 2 to 4 per strategic direction. And then we provide also examples of tasks or possible ways to personalize those directions. Of course, those need to be very context sensitive, and people will need to define whether that is applicable to their own context and country. So final takeaways of this. So there is a need for a profession-specific global strategy to guide the occupational therapy workforce strengthening, and that's what we're trying to do with this process. There was a 10-step participatory and published development process to provide a little bit of legitimacy, transparency, and trust to the process that led to this development. So this is not a work of a few authors. This is not the work of a few authors, but a work that were given rise by this participatory 10-step, very structured development process. And then there's a 3-level structure to provide an easy way to navigate the structure, and we'll see a little bit of that in the upcoming presentations. So thank you for that.
Thank you, Chair. I'm pleased to introduce Claudia Francois. He is the WFOT professional advisor. Over to Claudia.
Thank you very much, Richard. So there we go. So in this brief presentation, what I'd like to do is just provide a little bit more information about the content of the global strategy. Diego's done a great job of talking about how it's structured. So I'll talk a little bit more about the content and introduce some of the work that WFOT has been doing in relation to the strategy. So first, I just wanted to mention that we have developed a report on the global strategy for the occupational therapy workforce that's available from the WFOT website. And the entire publication is available in English, and plus translations are also available of the executive summary in Arabic, German, and Spanish, and soon to be also in French. The full report provides a full description of the strategy and details the 7 strategic directions, plus the specific actions and task examples in the 3-level structure that Diego had talked about in his presentation. We've also created a new workforce development section on our website that includes the global strategy and other workforce initiatives of WFOT, including a new WFOT Workforce Hub. So the Workforce Hub has been created as an interactive site that allows sharing of resources which are useful for occupational therapy, workforce planning, development, and evaluation. We realize that workforce issues concern the profession from many different perspectives. And many people are working on initiatives that are relevant to the workforce strategy. We're therefore looking for occupational therapists, occupational therapy organizations, educators, regulators, researchers, as well as workforce planners to share the resources on the Workforce Hub that they've been working on or have developed. Resources such as reports, studies, and other tools. By sharing your resources, others can benefit from your work and see how they too can implement planning, development, and evaluation tools to address workforce issues that they're facing. When making a submission to the Workforce Hub, you're asked to assign the resource to one of the 7 strategic priorities of the global strategy. The first strategic direction involves strengthening the occupational therapy workforce data. Knowing the status of the occupational therapy workforce is required to identify needs and monitor workforce development over time. Famous quotes from management guru Peter Drucker emphasize the importance of such data, such as, if you can't measure it, you can't manage it, and what gets measured gets improved. The second strategic direction involves aligning occupational therapy workforce data with population health needs and health systems demands for determining supply shortages. Having identified the supply shortages, the third strategic direction involves investment and technical support for expanding education and developing local capacity for workforce expansion. Improving workforce supply generally is not enough, however. Inequities exist in the distribution of occupational therapists and population access to occupational therapy services. And that was shown in the graphs that Diego had provided for us. Often those inequities are defined by factors such as geographic region, urban, rural, remote location, and sector, service, or practice areas. The fourth strategic direction, therefore, involves actions such as recruitment and retention benefits, innovative service delivery models, and outreach programs to improve workforce distribution for providing and improving equitable access to occupational therapy. As well as improving availability and accessibility of occupational therapists, workforce planning must also ensure requirements are met for workforce competency, engagement, and diversity, the fifth strategic priority. The sixth strategic direction involves fostering development and use of workforce research to inform policy and management. Actions include developing workforce research structures, networks, and agendas to generate needed evidence and systematically using evidence to inform and evaluate policies, planning, regulation, and management practices. Lastly, strategic direction number 7 involves building workforce leadership and planning capacity. This requires developing current and future professional leaders at the local, national, and international level to serve as advocates and participants in broader health workforce planning and policy. addition to leading the development of the global workforce strategy and creating the global hub for strengthening the occupational therapy workforce, WFOT has plans for a number of initiatives to implement the strategy. Our current plans include developing an international framework of occupational therapy workforce data, together with tools to enable reliable collection, tracking engagement, creating workforce strategy implementation sharing opportunities at the WFOT Congress, and continually updating the scoping review. Advocating for occupational therapy, particularly around classification and recognition at an international and national level. Addressing health workforce priorities stated in the WFOT collaboration plan with the World Health Organization, and supporting leadership for building the occupational therapy workforce and devoting resources and assigning responsibilities within WFOT to enable leadership in workforce development. Thank you.
Sorry, you won't be able to see me, but thank you, Claudia. I think that really gives a good overview of it. Sorry, now you should be able to see me. That gives a really good overview of the strategy. And I think one of the key highlights that we've been mentioning is that WFOT is providing a framework where really it's about how this can be implemented by and with the support of our member organisations. So I'm pleased to give some introductions now to examples of how member organisations have started to develop their own workforce plans and how this combines with WFOT's work with global strategy. So I'll hand over now to Karen Orley, who is from the Royal College of Occupational Therapists, Director of Practice and Innovation.
Thank you, Richard, and hello, everyone. We're delighted that really welcome this global strategy now that's come from the WFOT, because I think it will help to really move the occupational therapy profession and workforce forward. In March of this year, the Royal College of Occupational Therapists launched its first ever workforce strategy. And our vision for occupational therapy, sorry, I'm just moving the slides along. So our vision for the occupational therapy workforce in the UK, by 2035, we're looking for an increased workforce that's positioned to have maximum impact in improving people's health and quality of life. In the UK, as a professional body, we were approached by external stakeholders, including government departments, for data and intelligence on the occupational therapy workforce. And we're also being contacted by members sharing their experiences and asking, is this comparable to other regions, to other sectors? But as the professional body, we didn't have a comprehensive overview of workforce data. We had made a previous attempt at a workforce dashboard, which was expensive and really just confirmed the gaps and inaccuracies in the data that was available to us. Workforce intelligence remained a bit of an art form, based on some data, anecdote and extrapolation. But in 2022, it was clear that the demand for occupational therapy was increasing in the UK and that there are real shortages for occupational therapists in some parts of the country and areas of practice. What we didn't know was this a short-term issue due to the COVID pandemic, or was this a potential trend? And this really gave us the impetus to move workforce from being in the too difficult pile to one that we need to address. And this is how we came about our vision. And we set ourselves the goal of 2035, as we felt that that was far enough in advance for us to start to make some changes, but not so far in the future that it was very difficult for people to imagine. So how did we do this? For a start, the WFOT's HR project findings gave us our 7 strategic priority headings and the framework to initially explore what we know, what was already out there, and it broke the task into bite-sized chunks so that we felt we could use our assets, draw on members and our stakeholders to share their intelligence and to put everything together. So over 18 months, we developed our strategy drawing on a series of workforce summits, co-run with regional government teams, bringing in occupational therapists, managers, decision makers to discuss current practice, challenges, gaps and initiatives. We ran some stop, start and continue conversations. We also held a workforce survey, reviews of the literature and national policies and plans, and we had roundtable discussions with external stakeholders. Finally, we narrowed our focus onto 4 strategic priority areas for delivery: effective workforce planning, value and impact, optimising occupational therapy, and learning and career development. As a professional body, we're not tied up to the day-to-day challenge of maintaining services, and we're in a unique position. We can facilitate conversation, offer challenge, capture innovation and support the 48,000 occupational therapists in the UK to be change makers. So when we looked at optimising occupational therapy, we set the goal to support occupational therapy practitioners to be the change makers, using their skills and knowledge to lead and co-design innovative products, interventions and services that improve people's lives and well-being. And we can champion that. We've done this by designing an innovation hub so that people can submit pilots, their service improvement, quality assurance examples, and then we can search those as occupational therapists, draw on the learning and build on them and build on that real world evidence. And then in terms of demonstrating value and impact, although we don't commission the OT workforce or make system-wide decisions on delivery, we can pose questions. Where do we sit in the education, health and social care system? Is that the best position for us to be in? How and where do we provide value and have the most impact on the populations we serve? Currently, the bulk of attention and resourcing goes into acute hospital services, but national policy, projected population need and the public purse recognise public health, prevention and early intervention is the only way for services to be sustainable and for better quality of life for people living with health conditions and complex needs. By raising questions and driving forward the conversation, generating examples of pilots, research, service improvement, we can build the business case for occupational therapy in improving people's lives by intervening early. And so we want to do that hand in hand with our leaders so that we can move this forward not only at a national level, but a regional and local level too. And then retention and career development. The strategy is a framework that allows us to work with occupational therapy practitioners to drive change and innovation and share and build our collective learning. We are a female-dominated profession and we do not mirror the diversity within the UK. This is changing through our student population, but we want to ensure that we're supporting occupational therapists to reach where they want to be and have the many careers that they can have now within their working life registered as occupational therapists. So this will include actively supporting people from previously marginalised backgrounds to ensure that they get the opportunity to develop research, step into leadership positions, and really help to innovate and change and bring our practice forward. And then with our 4th priority, there is incomplete workforce data and intelligence out there, and the only way this will be improved will be if we keep using the existing data and demanding improvement. So rather than bemoaning the lack of data, we're trying to work with our members to support them to find out what is available and to consider how they can use it to drive the business case for occupational therapy. So the strategy has now kicked off a series of actions under those 4 strategic areas that I've just described. And the exciting aspect is that with virtual tools, we can now work closely with members and be the conduit for collecting what they do, sharing the learning and amplifying the research evidence and impact as it comes in. I'd urge other countries to consider what they can do to enhance our collective intelligence and evidence for the workforce. It's a learning through doing exercise. Take workforce data and planning out of the difficult pile, break it down into manageable actions, track, evaluate, and learn. It's very OT. Thank you. And, for further details and actions about our workforce strategy, please go onto our website, rcot.co.uk. Thank you.
Thanks, Karen, for a fantastic presentation. I think it is a real example here of how that there is no right or wrong approach to doing this, but engaging with the key stakeholders, both nationally and regionally, are an integral part of building this strategy. And very grateful for the work that the Royal College has done, along with many other organisations which are also picking up with the strategy too. But you probably saw in Karen's presentation that it's about prioritising sometimes. Which ones of these strategies are we going to start with? And a lot of that is sometimes about resource, knowledge, and understanding. And this is where we hope that the evidence and the work that we're putting into the Global Workforce Hub will also be a conduit to support those individuals, member organisations in engaging and understanding the terminology, the approaches that people are using. So thank you, Karen, for your presentation. I'm pleased to next introduce Dr. Pache Douglas Sampson, who is the WFOT delegate from the Bermuda Occupational Therapy Association. Over to you, Pache.
Thank you, Richard, and welcome everyone. So from the Bermuda Occupational Therapy Association, we decided that it'll be important to give you some context first about Bermuda and the occupational therapy workforce here. So Bermuda has approximately 35 registered occupational therapists, and the majority of us are educated within the United Kingdom, United States of America, and Canada. Our registration criteria is enforced by our Bermuda Health Council and the Board of Occupational Therapists, and they require that you must have graduated from a WFOT-approved education program, and our registration period is every 2 years. Most of us are employed at the Bermuda Hospitals Board, the Department of Health, or in private practice. We decided to start with this graph because it outlines our population. Bermuda has approximately 64,000 people, and we have a huge aging population. In the graph, you can see this is from 2016. This has changed since then. So these people that are in the age brackets of 50 to 60 are now at 60 to 70, and it's just increasing as the years go by. $83.5 years is our projected life expectancy by 2030. 1 in 3 people will age over 65 by 2039. 50% of residents have at least one chronic condition such as diabetes, heart, or kidney disease. 1 in 3 residents have high blood pressure or high cholesterol. Cardiovascular diseases account for 1/3 of all deaths in the recent years. Bermuda has the 3rd highest incidence rate of diabetes in the OECD, with over 13% of residents diagnosed. 12% of residents are uninsured. And the main causes of death are due to external causes, and they're related to transportation, accidents, or collisions. This data is from 2016, so it is much higher, which means it's unfortunately worse now in 2024. So Bermuda has a health strategy 2022 to 2027. Bermuda will be implementing a unified model of health financing akin to a single-payer system to ensure the population has access to affordable essential healthcare. Remember, our uninsured population in 2016 was 12%. It is now much higher. That data has not been recorded yet. This universal healthcare system aims to increase access to basic healthcare insurance, encouraging and expanding the use of community-based care, encourage healthy lifestyles through involving health professionals and organizations, and increase the access to intervention to prevent and manage non-communicable diseases and their risk factors. As such, reforms will focus on the review of the current basic plan and opportunities for its improvement to accomplish the stated priorities. Along with identifying specific services to include for coverage, it is also important to determine how these services can fit into a larger whole system approach to public health improvement. So there are some concerns from the local OTs here. The present standard health benefit has limited visit coverage for therapeutic intervention, and there is an inadequate reimbursement rate set by health insurers. Occupational therapy services and other rehabilitative services were not initially included in the new universal healthcare package. In the beginning stages, representatives from the association and the board had little to no collaborative involvement in the primary care pathways, especially those related to chronic care disease. We also had concerns of education programs. In March 2017, as per an initiative from the Pan American Health Organization, the Bermuda Ministry of Health drafted a dossier to provide an overview of the local healthcare workforce. It highlighted health professions currently on the island, identified the gaps, and proposed a plan to build the workforce. The Bermuda College formulated a nursing and nursing aid assistant program pathway in 2012 and 2014 to spark interest within the field, and then later moved on to allied health. So over the next few years, a committee was formed of healthcare stakeholders to address the gaps within the healthcare workforce by developing pathways. As part of our registration guidelines, you must have graduated from a WFOT education program in order for you to be registered in Bermuda. Unfortunately, Bermuda College is not. Another issue in regards to certified assistants also falling under the education programs. The World Physiotherapy Association, or the Confederation of Physical Therapy, does not advocate for assistance specifically as the assistants are utilized to replace therapists in many countries around the world. This, unfortunately, is a similar consensus here in Bermuda. We feel that the assistants will replace the need for therapists in allied health professions. Within our Allied Health Professions Act of 1973, all allied health professions within Bermuda are regulated by the Council, which falls under the Ministry of Health. Currently, certified assistants are not regulated under the Allied Health Professions Act. However, it may be considered as an amendment in the future. The rehab assistant programs required extensive collaboration amongst all allied health professions and stakeholders in order to ensure the career pathway is the right choice for the community and healthcare system. That includes at a legislative level, registration and licensing criteria, public health needs, workforce development, and curriculum development. This is particularly important for the association and the board because we want to ensure that people that are coming into the profession are able to be registered and can work. So if there's concerns, we did look at the global workforce strategy, and we realized it was quite intimidating with all the strategies that were available. So we narrowed it down into a few that we felt fit our association objectives. We started with Strategic Direction 1, which is strengthening occupational therapy workforce data. One of our main issues was staff retention, not just staff recruitment, but staff retention. We wanted to look more at retention because recruitment always seems like the issue, but each facility or system that employs OTs will need to further investigate the issues or concerns with retaining staff. But we must stress the importance of a workforce data set. We need to collect the data to determine how the OTs are coming in and how long they're staying within the facilities that employ OTs. We may look at new grads versus current supply and report who works where. The next strategy was number 2, determining supply shortages in the occupational therapy workforce. We know there's an issue with supply. There's approximately 35 of us. The length of time it can take for hiring, work permits for overseas workers, and balancing the current workforce and Bermudan OTs returning home. There are obvious gaps within our system and our OT practice. For a country of 64,000 and 35 OTs, it may not cut it. Some reasons is that the length of time it takes for the hiring process, especially those coming from overseas, it's all based on immigration policy and how often the regulatory boards need to process applications. We go look further into the immigration policy. All businesses in Bermuda have to advertise locally in case any appropriate Bermudian is available. This can specifically be an issue if a position is held by a work permit holder and is not up for renewal by the time a new graduate is returning home. Therefore, it'll make it difficult for them to enter the workforce in their own country right away. We feel we can address this issue through data sets again. They'll further help us with planning for hiring delays as well as considering changes affecting population needs. Our next strategy was strategy 3, invest in the expansion of occupational therapy workforce. The issue was inclusion of rehabilitation services within universal healthcare. Like I said, originally, occupational therapy was not included in the unified system. Due to the challenges with the initial standard benefit plan and the percentage of population uninsured and underinsured, access to these services were very limited. We plan to address this issue by being involved in working groups and being in the discussion, especially around primary care, utilizing resources from WFOT for care pathways and global initiatives. An update on this particular strategy is that we are now participating in those working groups. Our last strategy was strategy 5, assuring workforce competency, engagement, and diversity. Our issue here is job descriptions. Our job descriptions use career-based frameworks on competencies instead of qualifications. We want them, to use more career-based frameworks on competencies instead of qualifications. Bermuda is geographically located where it is. It's strategically located where it will receive workers from, like I said, Canada, US, or UK. We're in the middle of the Atlantic. This does bring diversity to the profession and population, which is very good. However, each OT may hold different credentials and/or qualifications based on the country of study. Given this, we must understand this does not make someone more qualified over another. This also needs to be communicated within the entire OT workforce and healthcare, as we do not want to eliminate a potential candidate because our job description requests a specific degree. We are saying here that career-based framework on competencies should be considered. We plan to address this within our regulatory bodies, the Board of Occupational Therapy here in Bermuda, to communicate the standards expected of the profession, which they have done. Within the rehab service and service delivery, we must align staff competencies and activities with population needs. This may also help to identify knowledge and skill goals. So we have 4 strategic directions that we were hoping to get through as an association. But as we are small, we realize we must be strategic in our methods and implementation of the workforce strategy. Therefore, we have decided to start at promotion and increasing awareness of the profession at many different levels through advocacy in our country. That means that we've started with strategy 3. So we will be providing promotional and advocacy at a ministerial level, legislative, and our regulatory system, within our employment sectors and the general public and community. Thank you.
Thank you, Pasha. I think it's really important to look at how different organisations are approaching it based on their workforce, based on their resources. Bermuda, as we know, a small human resource workforce. And I think looking at the different approaches that Pasha has outlined is a really good indication of how we can work collaboratively across different size organisations and populations. Moving on now, we're going to introduce Samantha Chan, who is the WFOT president. And Samantha's going to provide an introduction to the international context in relation to the workforce strategy.
Thanks, Richard, and thanks to everybody joining. And thank you to the speakers. As Richard said, we've heard from two very different member organisations of WFOT about how they're implementing workforce strategy. And it's really interesting to see how resources have an effect on that. Tiago mentioned it earlier in his presentation, but I think it's really important to think about why now is really important to be thinking about this. We know that one of the targets from the United Nations Sustainable Development Goals is about universal health coverage, which means that all people should have access to the full range of quality health services that they need when and where they need them without financial hardship. And the World Health Organization, since 2017, recognising that 2.4 billion people around the world experience a health condition that could benefit from rehabilitation, have made rehabilitation a focus, launching Rehabilitation 2030. Rehabilitation 2030 has 10 key aims, and they range from looking at leadership within rehabilitation, strengthening the workforce, integration of rehabilitation into health systems, ensuring that there is a strong workforce capacity, looking at how rehab services are financed and how we collect data and systems analysis around that, building research capacity specifically around rehabilitation, and establishing and strengthening networks and partnerships with that. If you go onto the WHO website, you'll find a lot of resources related to Rehabilitation 2030. And WHO, along with its member states, so our ministries of health predominantly around the world, have started to look and analyse and starting to develop rehabilitation services. So there are documents on there helping us to look at how we do assessment of rehabilitation in countries, looking at how we grow workforce and do workforce evaluations, how we can look at financial capacity. And there are also packages of rehabilitation interventions, which many occupational therapists have been involved in producing. WHO works through its member states, so it goes into countries at invitation. And we can see that since its launch in 2017, the rehabilitation footprint has been moving across the globe. And this slide shows where WHO has actively been working with member states and ministries of health to look at rehabilitation services. And some of you around the world may have been involved in those assessments and in those planning meetings. And this is exciting, but actually, if you look at that map, there's still big areas of gaps. So whilst the focus of Rehabilitation 2030 is really exciting, it was a call to action. And as we know, call to actions are just that. People can listen to them, but do they actually have to act upon that? So where was the game changer really? That probably came in May 2023, when at the World Health Assembly, there was a resolution. And this was the first resolution around rehabilitation in the World Health Organization's 75 history. And this resolution, looking at strengthening rehabilitation in health systems, really is a strong acknowledgement from ministries of health around the world who signed this resolution unanimously, recognising there is a huge unmet need for rehabilitation. acknowledging that rehabilitation is not just about the services provided, but about properly quality education of health professionals. And that rehabilitation is made up of a multitude of different professionals. And this resolution was really the first strong commitment from ministries of health about a commitment to invest in rehabilitation. Following on from that World Health Assembly resolution, alongside the work of Rehabilitation 2030, the World Health Organization also hosted a global network of stakeholders looking at a mission to support the implementation of Rehabilitation 2030, but making sure that there were a lot of advocacy activities. And this is the World Rehabilitation Alliance, and the World Federation of Occupational Therapists is one of the founding members of the WRA. And the WRA is there to ensure that there's evidence-based activities around raising awareness of rehabilitation and looking at strengthening networking and knowledge sharing within the rehabilitation sector. So how does that fit together? So we have the World Health Assembly resolution, which is this strong commitment from ministries of health around the world to invest in rehabilitation. We have Rehabilitation 2030 from the World Health Organization, which is about producing evidence, creating capacity, and supporting countries to develop their rehabilitation services. And we also have the World Rehabilitation Alliance, which is about raising awareness, creating demand, and mobilising political will. And as I say, from a World Federation of Occupational Therapists perspective, we're involved in all of these projects. The World Rehabilitation Alliance has 5 key areas around external affairs, primary health care, emergency care, research, and workforce development. And myself, as president of the World Federation of Occupational Therapists, is part of the steering committee for the World Rehabilitation Alliance, taking a lead on the workforce work stream within that. So we do have a strong presence. Rehabilitation is also a big part of the World Federation's collaboration plan with the World Health Organization. And this allows us to have a strong voice about what occupational therapy brings to the rehabilitation table, but also helps us to take that outside in some of the other areas around mental health, aging and life course, and human resources. So why is all of this really, really important? It's really exciting that the World Health Organization is having such a strong focus on rehabilitation. The World Federation of Occupational Therapists is at that table. We are part of all those rehabilitation meetings, and our strong message within all of that rehabilitation work is that occupational therapy is essential in rehabilitation, and that investment in rehabilitation must include investment in occupational therapy. And that's great. We can have this global voice within the World Health Organization, within all of this rehabilitation focus and Ministry of Health, but we also must write our own narrative. As occupational therapists, we must be involved in shaping and influencing our own future and our own destiny. And that's why the WFOT workforce strategy is so important. So thank you, and I'll hand back to Richard.
Thank you, Samantha, for providing that international context. I do feel that it's an important part of our global recognition within a much wider community, but we play an important part. I'd like to bring the panelists back onto the screen now, and also if somebody could just move the next slide on. Because I can't. As part of this strategy, we are going to be hosting a number of different webinars every 2 months, focusing on different elements of the strategy and its applicability to different groups and stakeholders. So in January, we will be hosting a session on leadership, advocacy and policy, workforce data and research in April, workforce management and retention in June, and occupational therapy educational scholarship later in 2025. So, like I said, there's been some fantastic questions posted in the Q&A section. Sadly, we're out of time. However, we will make a commitment to respond to each of these and posting these on the new Global Workforce Hub by early next week. A copy of this presentation will also be available online. As we conclude today, I just want to emphasize the success of this global strategy depends on each of us. It's not just a document or set of objectives. It's a collective commitment to shaping the future of our profession, and most importantly, the lives of people we serve. Together we can and will make a difference, not just for our profession, but for the millions of people who rely on occupational therapy to live full, independent and meaningful lives. Thank you for your dedication, and let's move forward with determination and hope for a brighter future. I would again like to thank all of the panelists. It's been a great opportunity to engage with you. Over 1,000 people have registered for the webinar. And we look forward to more of these series in the coming weeks and months. So thank you, and we will be in touch again soon.